Hello, in this tutorial video I will demonstrate the positions and relationships of some important anatomical structures in the abdominal and the pelvic cavity of the male goat. So the information that is used to describe these relationships was obtained after dissecting the pelvic region of the goat, and the dissection was based on the book titled Guide to Ruminant Anatomy, based on the dissection of the goat. So the picture shown on this slide was taken after removal of the left hind limb of the male goat. This was in order to observe the position and relationships of specifically the urinary bladder, the lateral ligament of the bladder, the ureter, the testicular artery and vein, the ductus deferens, the spermatic cord, and also the deep inguinal ring or the deep vaginal ring, as well as the internal and external abdominal oblique muscles. The procedure, as explained in the previous slide, followed the book from Philip Gallet, and it was as follows. The male goat was put on its right lateral recumbency, and then on the left pelvic limb, the ischiatic nerve and the caudogluteal artery were cut near the hip joint, and the body wall and iliacus muscle were cut, and the body of the ilium was sewed or cut near the major ischiatic foramen. Then a sagittal incision was made through the muscles about 1 centimeter from the ventral midline. And then the obturator foramen was also cut with a saw. The hind limb was then removed without disturbing the pelvic organs. So on this picture now, to demonstrate the relationships of and positions of the various structures that I've mentioned, on this picture we can see the external and internal abdominal oblique muscles as labeled there. And these muscles, their aponeurosis contribute to the formation of the deep vaginal ring and also to the formation of the inguinal canal. Here we can see the contents of the spermatic cord, which contains the ductus deferens, the testicular artery, the pampiniform plexus, as well as lymphatics and nerves, which enter and leave the inguinal canal through the deep vaginal ring as shown there. Now, as the spermatic cord structures progress proximally into the abdominal cavity, they separate. So those are the spermatic cord structures. Initially, they are still bound together by connective tissue, but as they progress proximally, they begin to separate. So we can see that the testicular artery and the vas deferens or the ductus deferens have separated proximally as they are going into the abdominal cavity. Then the testicular artery will connect directly to the abdominal aorta, while the right testicular vein will terminate into the chorda vena cava. But of course, there are many species variations in how the testicular vein will deposit its blood into the chorda vena cava. Then further proximally, we can see the urinary bladder as indicated there. And we can also see the lateral ligament of the urinary bladder, which is part of the genital fold. And also we can see the ureter, which is coming from the right kidney to join the urinary bladder dorsally. The lateral ligament of the bladder or the genital fold can be used as a landmark to locate the ductus deferens during certain abdominal surgeries. So it's a landmark that is useful in some surgeries. Also notice that the ductus deferens passes medially to the ureter before reaching the ampulla. And this close relationship of the ductus deferens and the ureter is constant in all domestic animals. So forcibly pulling on the ductus deferens during castrations may tear the ureter away from the urinary bladder because of this close relationship. Such force also causes the testicular artery, or it may cause the testicular artery to break and to break away from the abdominal aorta, and this can result in uncontrolled internal hemorrhage, which can cause a lot of problems. Therefore, care should be taken during castration and other surgical procedures in this area. Thank you for listening and watching.